It is Feel Good Friday. We're hearing a lot of feel-good stories. We're at the Neurometabolic Associates located here off Linden Lane with Dr. Anthony Sears. Dr. Sears, we're going to go to the phones, but we're going to dedicate this segment to people who have thyroid issues. However, we've asked for your calls, so we're going to take them. Let's talk to Sean first. Sean, welcome to Wave 3 Listens Live.
Yes, how you doing?
We're doing well. You have a question for Dr. Sears?
Yes, just if he's heard anything or studied anything about cell phones causing brain damage or brain cancer. Just wondering if that might. I know Parkinson's, exceeds before cell phones really came about, but there's been studies about cell phones with the frequencies and the radiation from a cell phone. Is it causing some kind of brain damage or brain dysfunction?
Okay, so the question about cell phones, can they cause damage to the brain and maybe instigate Parkinson's or any kind of brain disorder?
Yes, there's actually a lot of studies out there now, and you got to be careful with that, especially the Bluetooth. There's all these transmissions coming to the brain in this area. There's tons of studies out there. If you want to call my office, I can email you, send me your email, I can email you all the studies on this, but you got to be very careful with that. If you buy a cell phone, it comes with the old wire, you put it in your ear like we used to do it about 5-10 years ago. That's actually a whole lot better for you to use than using a Bluetooth, because when you use a Bluetooth, even though it's more convenient, you're sending signals to your brain in that area. So absolutely.
That makes perfect sense. All right, we have another caller. Mary is with us now. Mary, welcome to Wave 3 Listens Live.
Hi, good afternoon. I'm calling about understanding his educational background. Are you an MD or a PhD or a chiropractor? And how are you able to call yourself a doctor?
Yes, good question. I started out as a chiropractor, actually. I don't use my chiropractic license much anymore. If I have a patient that wants chiropractic done, we'll do that. But I'm actually board certified in integrative medicine, and I have a diploma in integrative medicine. So what that is basically it's natural medicine. So I've got over 300 hours of postgraduate work in functional medicine and 300 hours of postgraduate work in functional neurology.
All right, and thank you for the call, Mary. Appreciate that. All right, as I said, we're going to dedicate this segment to thyroid and the conditions of thyroid. Before we do, we have another call we're going to try to squeeze in real quickly with Mary. Mary, welcome to the show. Another Mary, welcome in.
Thank you. I was wondering if there was anything they could do with scoliosis.
Scoliosis.
Yeah, I don't do much with that. There's some really good chiropractors in town, and Louisville actually concentrate on that. And if you Google, I think it's called the Clear Institute. They're actually out of Minnesota, but they train some chiropractors locally here in Louisville area. I can't remember the doctor's name off the hand, but if you go to the Clear Institute, you'll find out plenty of stuff about scoliosis.
All right, we're going to squeeze in another one. You're very popular.
Yeah.
Putting Dr. Sears to work here. Thomas is with us now. Thomas, welcome to Wave 3 Listens Live.
Hello, how's
Yes, go ahead, Thomas.
Yeah, I'd like to know what the difference between dystonia and Parkinson's is.
Well, Parkinson's is a totally different. Dystonia is just an abnormal movement, and Parkinson's what's really affecting the brain dramatically there. And like I said, usually with Parkinson's, we see the frontal lobe. When we do neural feedback, your frontal lobe will be undersensitized. It won't be working properly. So what happens is we use it's called a neural feedback. We actually have a website with that. It's www.neuralfeedbackofkentucky.com. It tells all kinds of information about that. But basically, it's about retraining the brain to get the frontal lobe working again. And that's why you'll see a big difference with that. And you'll see, like you said before, is how do you know when Parkinson's starting to come on? You look for any abnormal movements, and you got to really watch out for that. A simple test to do at home is do a simple finger-to-nose test. Close your eyes, have your spouse do this, and try to touch your nose with your eyes closed. If you're starting to see some twinge in there, you don't have to worry about Parkinson's coming, but you got to watch out for it. It's a warning sign for that.
All right. Once again, we're with Dr. Anthony Sears. Let's talk a little bit about thyroid. First of all, what is the thyroid, and what does it affect in regard to your health?
Really, the thyroid is so important. It's unbelievable. Up to 40 million people are having thyroid problems now. And the problem is that what we do a little bit different is a lot of women and men especially will go to their doctor. They'll see a commercial like mine, or they'll read my book and say, I have every one of these symptoms. I'm tired all the time. I have brain fogginess. I can't get up and go. I'm losing hair. I'm getting hair on my face. And they'll go get their thyroid test, and the doctor said, it's not a thyroid problem. It's normal. But here's the problem with that. Most traditional doctors and endocrinologists, nothing wrong with that. They test the gland itself. You're looking at things called TSH and T4. Here's the problem with that. If your T4 is normal, TSH is normal, they'll say you're fine. But what we look at, I call it more of a thyroid hormone dysregulation dysfunction. Okay, what I mean by that is the hormone goes all the way down. Your thyroid is the only gland in your body that affects the whole body. So what I mean by that is if the thyroid's off, it can give you anything. So you have to follow it all the way down to the proper testing. So that's why we do urine tests, blood tests, saliva tests, DNA testing to find out where the breakdown's at. And that's how you really fix a thyroid condition that way. And I feel like that's why we have the success that we do.
Okay, so if you're experiencing some of those symptoms, you said maybe tired, hair loss, or actually maybe more hair in places you're not accustomed to.
So a lot of women say, Doc, I'm losing hair up here and getting on my face. What is going on? And what happens is as women get older, sometimes we get more testosterone, which is what we have. And us men, we get more estrogen. So that can throw a big factor in your thyroid as well. But one of the most important factors for your thyroid, and for some reason a lot of doctors don't test for that in America, is your adrenal glands. Your adrenal glands sit on top of your kidneys, and they're the stress hormones, and they produce what's called cortisol. When that's off, that throws off your thyroid dramatically. And that's why you got to put everything together. That's why you cannot look at just TSH and T4 to fix a thyroid condition. And only 16% of people are getting better right now with traditional routes. Those 16% are very, very happy. But my job is to help out the other ones that don't get fixed.
Speaking of helping out the other ones, are you going to offer a free consultation here?
Absolutely. Same thing. The first 20 callers get a free consultation. It'll be about a 30-minute consultation. And we'll see if we're a good fit for each other and see if it's something you want to do.
All right. There's the number up on your screen. Again, that's a $250 value, absolutely free. Let's take some more phone calls. We've got a little bit of time here. We'll try to squeeze them in. Rachel is with us now. Rachel, welcome.
Yes.
You have Dr. Anthony Sears.
Hello, Dr. Anthony Sears.
Hey, Rachel.
Hi. I had a stroke about 17 years ago. I went into the hospital to have some minor surgery, and I came out with a stroke.
Mm-hmm.
I had a seizure, and it gave me a stroke, and I'd like to know about the brain, because I fall down all the time, and my thyroid gland is not working correctly. I know that because I don't have the eyebrows, and I have dry skin. I'm not losing any hair or growing any hair in any weird places, but I do think my thyroid is off.
Okay. And have you had any proper blood tests done on that? Have you been diagnosed with thyroid problems?
No, I haven't.
So you're saying your lab tests are normal, right?
Yes.
And that happens to a lot of people. That's why you got to test more than that. So here's what the strange thing with thyroid is. It produces two hormones, T4 and T3. And unfortunately, 93% of it's T4. It's inactive. Your body can't use it. That's what Synthroid is.
Okay.
It's inactive. So what happens is it's got to be converted over to T3. And T3 is the active form that your body actually uses. So when I see a thyroid patient, usually we'll see the most common things, Hashimoto's disease. It's just an autoimmunity of your thyroid. You might have an underconversion of T4 to T3. That means the hormone's not getting converted over. Or you could have an overconversion of reverse T3. And all that is if you have a blood test, you can look at the RT3, it's called reverse T3, and look at T3. You divide T3 by reverse T3, and that should be over 10. If it's not over 10, you don't have it. You're getting too much reverse T3 in your body. So that's the physiology we're talking about.
Hopefully that makes sense to you. Give Dr. Sears a call. We'll throw his number up on the screen. We shall return. It is Feel Good Friday. Metabolic Associates. We'll be right back on Wave 3 Listens.